So thank you very much, Dr. Zawar, for joining us.
It's a pleasure to be here. So nice to join this conference and present my work. I'll start sharing my screen. Can you see okay? Okay. Good morning, everyone. It's truly a pleasure to be here and talk to you about this, one of the most important topic on pain management in Parkinson's. So today I'll be talking about the power of non-pharmacological pain relief in Parkinson's disease. So the goal of today's topic is primarily understanding the pain presentation, causes of pain in Parkinson's disease, and how it changes over time. Uh, Understanding the impact of pain on the overall quality of life, and most important, finding ways on how can you design a unique treatment plan, a self-management plan to help you better manage your condition and help you continue being more active, and finding new ways on how can you uh, be engaged with the community, social activities, and just helping you return to your higher functional level. So as we get started, it's really important to understand the Parkinson's disease as a whole. As you all know, like Parkinson's disease presents with a combination of motor and non-motor presentation. So motor presentation includes right from slowness, tremor, rigidity, postural changes, whereas non-motor symptoms presents with wide range of presentation, right from pain, fatigue, sleep disturbances, mental health changes, changes in eyesight, and more. So it's really important to find ways on how can you manage these non-motor symptoms, effectively communicate with your team, and also discover new treatment, both pharmacological, non-pharmacological ones, to help you better cope with it. So looking at the prevalence of pain in Parkinson's disease in general, as compared to normal general population, Parkinson's disease have significantly higher level and prevalence of pain. The chronic pain is in general present around 20% in the individuals during the time of diagnosis, and at times may be one of the early motor signs, and it can affect up to 80% of individuals during the disease course. It really impacts the overall quality of life, and it's really important to understand and find ways on how can you better cope with it. So based on the research, 80% of individuals present with the non-motor pain on symptoms, including pain as one of the most prevalent during the disease course. So looking at the disease, like initially in the beginning, majority, like up to few, like 5% of individuals report as one of their primary symptoms. Pain can appear 1 to 2 years prior to the onset of the motor symptoms, and at times it can be presented as like just the shoulder arm pain, and that's one of the very typical early presentation. In the early phase of 0 to 5 years, pain is also related as one of the most common non-motor symptoms, and it typically affects the side of the body that has been more impacted by motor symptoms. Chronic pain is typically seen in up to 20% of individuals during the time of diagnosis. And in the advanced stages, pain is more common, and up to 35% or higher incidence of pain is reported in the advanced stages as compared to early stages. So as we learn about the prevalence of pain in PD, we also need to understand what are the primary causes of pain. So firstly, pain is a very complex experience, and it can be affected, and it can be caused because of multiple factors. Right from looking into the changes in the dopamine circuit, changes in the pain pathways, incidents of like just the age-related musculoskeletal changes, which may have impact on overall pain presentation, and changes in the inflammatory pain processing pathways, which may contribute to the pain experience. So they have noted that the researchers have noted that pain is felt differently in Parkinson's disease. It's mainly because of the lower threshold for pain perception and altered pain sensation. So that's one big reason. It's really important to understand why is pain more common and how can we better cope, better manage pain throughout the disease course. So looking at pain, with any fluctuation in the pain presentation, there is a significant and direct impact on overall physical activity, which results in decreased exercise tolerance, decreased activity tolerance, resulting in increased motor symptoms, and which in turn really affects the overall quality of life. So it's really, really important to find ways on how do we break this vicious cycle? How do you take control of your pain as early as possible? And this is what we'll be discovering and discussing further. Also looking at the overall impact, there has been changes in the exercise engagement, quality of life, overall disturbance in the mental well-being. So it's really important to understand, acknowledge, and find ways to treat it. So the first step in order to get this solving the pain cycle is looking into recognizing the pain pattern. Every individual has a different pain experience, different pain pattern. So it's really important to understand how is pain presented, differentiating it from the non-Parkinson specific pain. Um, Regularly tracking, communicating with the providers, and creating a very robust treatment plan which combines both self-management and multimodal treatment options. So firstly, what does pain mean to you? Pain is a very unpleasant sensory and emotional experience. At times, it's associated with actual or potential tissue damage. Pain is a very unique experience. It's an experience combining the changes in your sensation, your emotional feeling associated with the pain, your overall processing together contributes to the pain experience. So as we start looking into it, so the first and foremost is like understanding, recognizing how is it presented, then going forwards and seeing how can you differentiate if it's more regular pain presentation or is it more associated with pain in Parkinson's, and how do you track, how do you communicate, and continue with exploring what are the ways you can treat and manage your pain along with your Parkinson's. So firstly, pain, as you all know, can be presented early following any kind of injury, and it's more referred to as acute pain. It's a body's way to protect by having these signs of discomfort and having a way to guard, protect the joint. Whereas the chronic pain is the one which has been long lasting for more than 3 months and is being referred as more of a persistent pain presentation. Now, looking into if the pain presentation, is it related to Parkinson's disease or if it's unrelated? This is really important because that will help us understand if there needs to be any changes in your medication. How do you communicate about your pain to your neurologist? So when they are seeing you, they are able to make that medication adjustments. So I'll really like you to answer these questions, make a note, and make sure you get this to your doctor and your team. First and foremost, has your pain started or become severe since the onset of Parkinson's symptoms? Does your pain changes with rigidity, tremors, or slowness of movements? Does it get more intense? Is your pain associated with excessive or abnormal movement? And does your pain improve when taking Parkinson's medication? So look into this as seeing like, is your pain better during the on phase of Parkinson's when you have your medication versus during the off phase when you don't have your medication? Really track this information. And secondly, also see, has your pain started during the time of the Parkinson's disease presentation or diagnosis? Those are really two guiding factor in understanding if it's pain related or unrelated to Parkinson's. If you answered yes to any of these questions, then this means your pain is more related to Parkinson's disease. And as you go forwards, we also need to understand, how is your pain presentation? Is it more musculoskeletal pain? So if you see pain more around your joints, more with your increased muscle activity, especially when you see increased muscle activity during the off phase, more like dystonic pain. If it's more nerve related pain, or is it more generalized body pain? Those are like different ways to understand the pain presentation. So when we look into nociceptive pain, it's the pain which you see because of the changes in the joints, mainly like non-nerve related pain. That's when it's more of a combination of musculoskeletal or pain during the dystonia, where you see excessive muscle activity. So these are the two ways to look into the nociceptive, more of musculoskeletal pain, joint related pain is the best way to see this. And it can be due to the changes in the posture, right? From changes in the forward head posture, increase increased side bending, changes in the shoulder movements. At times, individual do experiences frozen shoulder, joint pain related to arthritis. And this is when, again, it's more joint pain related symptoms, and it can be referred more as nociceptive or musculoskeletal pain. Also, looking into musculoskeletal pain due to the motor fluctuation, especially during the off phase of medication, when you see like painful dystonia, which individuals at times experience early in the morning before the onset of their medication, and that's when it's more of dystonic related pain. And researchers have also noted that it may happen because of the increased use of levodopa treatments. This is important to track down if you experience pain in the morning before the first dose of your medication. So this will give a good information to your neurologist and may help them find ways to change or more alter the dosage if needed. Neuropathic pain is related more to the nerve related pain. It includes burning, electric shock like sensation, like pins and needles across the nerve cores. And at times, it may be exacerbated because of the postural changes in the Parkinson's disease. But as you're understanding it, look into seeing if you experience pain across the nerve cores, which is more burning, like electric shock or presence with pins and needle sensation. Nociplastic pain is more commonly referred as central pain. It is more diffused across the body. It keeps changing from the body region. It may at times be very difficult, burning sensation, presentation unexplainable at times. So anytime when you experience a generalized body pain, and the location keeps changing from one region to the other, and it's really hard to explain, that's when it's commonly referred as central pain. And it's mainly because of the increased overactivity of the pain system, nociceptive system, which triggers this. And symptoms like leg motor restlessness, off phase of the medication or just the visceral pain may also be maybe a part of the central pain presentation. Now, as you go forwards, we also need to look into how can you rate your pain level. So the first way to do is looking into the intensity of the pain. So on a scale of 0 to 10, what's the level of your pain? 10 meaning extreme and 0 meaning no pain. Following that, we need to look into the frequency. One is mild, moderate, severe. So you need to see how frequently do you experience pain, and also your impact on overall daily life. So again, 1 is mild, 2 is moderate, 3 is severe. So these are the 3 important factors which I'd like you to track down, note down. So this will help you communicate better and also look into understanding your pain presentation. Sorry, this slide. So yeah. Incidence and prevalence of chronic pain in Parkinson's disease is primarily nociceptive pain is one of the most commonly presented pain. It combines the joint-related musculoskeletal pain and dystonic pain. Central pain, radicular pain is also one of the common presentation. And then all other central pain have been classified as more other pain. So this has been the presentation of pain and Parkinson's. Individuals typically experience 1 to 2 types of pain, mainly during early and or advanced stages. And when we look at the musculoskeletal pain, majority of individuals reported lower limb and back as one of the common pain presentation scenarios. Now, looking and understanding more in depth, we really need to look into what are the relieving factors, what are the exaggerating factors which makes your pain worse, which makes your pain better. Looking into understanding the overall pain quality, how will you describe the pain? How does it feel like? Looking into if it is referred or if it moves across the body part, rating the pain, and also most importantly, looking at the timing and treatment, mainly seeing when did the pain start, how often does it occur, is it intermittent, is it constant, and if there is any relation to Parkinson's medication. These are very important to note down and to understand the pain. This is one other way to look into. I'll share this as well in the with y'all. So it's a way to understand like what are the relieving factors, what is the way to describe the pain. Same thing, looking at the correlation with the pain medication and the pain severity on a scale of 10. So first and foremost, as you're getting started with this, we really need to look into building your team and understanding the pain and managing the pain and Parkinson's. So the first step is definitely finding ways on how do you get connected with the movement disorder specialist or a neurologist, followed by neurophysical therapist, occupational therapist, speech therapist, psychologist, primary care doc, and wellness coach. So really finding resources and finding ways on how can you build your own team. So this way you have a strong network, and as and when needed, you can reach out, consult with them, design a specific treatment plan, and work towards it. So I highly encourage like tracking this down and finding ways on how to communicate with your neurologist will help you optimize your Parkinson's medication, and which is very crucial for pain management. And as you get going with building your team, strengthening your team, it's also important to see how do you make this more holistic, more integrative care, because it needs to be multidisciplinary teamwork, which helps you effectively manage your care. So when I see integrative care management, it involves creating a structured self-management routine, self-management care for you, combining interventions from your rehab team as and when needed, and finding ways on how do you optimize medication. So together, this will really help you take control of your pain, help you understand and better manage it. Looking into medication management is one of the ways where we see it's more as a passive approach. So as you get going with actively engaging and learning through education, which you're doing it today, practicing is really important, and that's when it makes a big difference. So in order for you to take control, actively manage, it's really important that you find ways on understanding pain, engaging, communicating, and finding really new ways to be more and more involved in your pain management, Parkinson's disease management process. So integrative care management is very crucial, and the primary goals of doing through the self-management through other means is to understand how can you take control of your pain through tools and skills necessary for self-management, finding ways on how can you reduce reliance on medication, and how do you continuously participate in physical and social activities. And it involves different skill sets, right from finding ways on how do you adaptively problem solve based on the presentation, based on your feeling and other factors going on. It's also important to develop the tools, the skill sets which helps you do it, and with time taking control and continuing with your day-to-day activities in more better and efficient ways. So self-management is one of the very unique concept, very unique application of education and supportive intervention. It's delivered by healthcare experts, and it's primarily designed to increase skills and confidence. So think of self-management as a way to help you boost your skill sets, and it's typically done in a workshop or series of lectures which involves active engagement. It's just not education sharing, but it's also helping you build your toolbox of skills, technique, healthy habits, because it's difficult. It takes time, right, to build that robust system, to understand, to design the day, design your activities to help you better manage your symptoms throughout. So it needs a combination of skill sets, training, looking into understanding your trigger factors, your relieving factors, finding ways on how do you cope with it, and uh, on the go also finding ways to challenge yourself as you're doing these training, the skill building. It's one of the ways to help you become an expert on managing your pain. So when you look into this self-management program, think of it more as a immersive learning, which is targeted in helping you advance your skills and apply those skills. That's very crucial, because building a toolbox and creating those healthy habits, routines makes a big difference. And in order for you or for any of us to do it, it's a step-by-step process, and it needs a good a good education, good training tools in order to help you achieve it. So when we talk about this, it's important because it really helps you take in control of your disease, help you independently with support of your healthcare team, manage it, and it just gives you more power, more confidence in coping with your disease. So highly recommended, like if you have the opportunity, if you have the tools, and if you are someone who wants to explore new ways on how do you better self-manage, then this is something really important to help you effectively cope and manage your disease. So In order for me to explain this self-management, I know it's too broad, but something which I'd like to share with you is one of the a special program, which is Parkinson's Power Up program, which we did in US um, through Beyond Rehab in partnership with Parkinson's Foundation and APDA. And it was done over a course of 4 weeks, virtual setting. And the whole goal of this program was helping individuals take control of their pain and help them return to higher level of activities with time. And it was divided into 4 different components. So the one was mainly understanding the pain neuroscience education, then looking into reconnecting, retraining, sensory motor retraining, functional training to help them gradually find ways on how do they retrain their nervous system. Also looking into understanding the flare-up episodes, freezing management, and lastly, finding ways on how do they re-engage back to the community activities, which are Parkinson specific and day-to-day social activities. So this was all geared towards enhancing the pain understanding on how individuals can effectively interpret pain, understand overall pain and experience, and increase their confidence and autonomy in managing pain. Building active coping skills, this is huge because it's a way to help you take the health and well-being responsibility from from the healthcare professional and therapist to you. So it's like a big shift. So it's like shifting from the responsibility from the team to you. So you are the one who's fully in charge of managing your care, and you're discovering, you're building your tool sets, and you are the one who's driving the car. So finding the ways on how do you actively cope and develop those skills with time, with practice, with repetition. And definitely re-engaging in new life activities, finding ways on how do you decrease fear, increase movement, and engagement. We noted towards the end of this program, there was a decreased dependency on over-the-counter pain medication by 20%, increased use of active coping strategy. This really helped individuals take control by 30%. Overall improvement in confidence and engagement in physical activity. And this program was done in a group setting, so it really helped individuals connect with their peers, learn from their experiences, and find new ways on how to better beat the pain. So as you're learning and understanding new things, I really want you to look into finding new ways, new opportunities on how do you manage pain. There are so many ways along with medication which you can start doing, right from tracking, communicating, seeing when your pain is more managed, what something really works, and seeing if that's something you can translate during the off phase or during the flare up. So get yourself started, definitely from the standpoint of tracking and seeing what something helps you be more in control of pain. How is your pain during the on phase, if you have that different pain experience during the on and off, and what's something you will like to work with your team members, right from your neurophysical therapist, occupational therapist, and the docs, and that will be a good start. It's really important to see that recovery is possible through reconnecting, retraining, re-engagement. So it's a step-by-step process, but getting started is really crucial, and finding ways to build your team, communicate with your team provider is very important. So the next big step is helping you understand what other ways you can take control or get ready for this change. So as I've been mentioning, like, tracking and maintaining a pain log diary is really important. Communicating and discussing with your team, right from your neurologist, neuro PTs, other team members, Do collaborate closely with your healthcare team for effective pain management of your symptoms and enhance your overall self-management abilities and overall confidence in managing it. So as you continue finding ways on combining different interventions, different therapies, finding ways to work with your team members, it is really important you keep on taking an active role in this process. And through your approach, through your work with your team members and learning, you'll be able to find new ways to better understand, better manage pain with time. So I really encourage you to get this tracking, get this understanding of your pain started. Definitely see where do you see yourself being more challenged with day-to-day activities, and what's something you like to do differently or you like to get back to. So with that thought process, with that tracking, you'll be able to find new ways, new steps on managing and solving the pain. I will also like you to look into this program if you're interested in learning more about pain management. It's a online program. It's Parkinson's Power Up program, a self-management program, helping you discover new ways on understanding pain, building the skills and tool sets necessary for day-to-day pain management. And it involves guided workbook, guided recording, and treatment plan, which you can easily learn by yourself, apply it, and find new options to cope and take control of it. Thank you so much for joining me today. It's absolutely a pleasure to have this opportunity to talk to you, to discuss one of the very common topic. And I invite you to share your questions and share your overall experience, how you've been managing pain and what's something you're looking to do differently. Thank you. Thank you so much.
Thank you very much, Dr. Zawara. I'm Charlene. I'm one of the client services coordinators in the Edmonton office, and I will try my best to field some questions that will be coming in through the chat. So I think one of the first questions that we had come in was, how do you find these team members?
So definitely having the resources from your team, like looking into Parkinson's Association in your area, seeing if they are able to provide you with the list of neurologists, neurophysical therapists, that will be a good start. Seeing in your network, in your hospital system, who is someone working and specialized in working with Parkinson's. This way you'll be able to connect and see if that individual, if that expert is right for you. That will be a good start. And also connect with your peers. I know it's different in Canada, so definitely having that learning from the community will help you see what other options available in your area.
We also have a question about someone that's not able to get out of their house. Are there suggestions or recommendations for movement that people could do that would be pain relieving?
So movement is it's a very individual individual plan experience, I'll say. So just finding ways on what's something you are okay to do. So maybe just starting with simple chair yoga, seeing if that something helps you, seeing if simple movements in sitting is that, if that something is okay with you, that may need some exploration. And if you have a chance to connect with a home physical therapist who can come to your place, who can do a quick assessment, give you a plan to work towards, that will be very important. So I'll say two things: explore movement through simple chair yoga exercises, simple walking in the home, and see if that helps. And what can you like to do along with your day-to-day activities, and see what type of help can you get at home, right? From having a home physical therapist or finding like also telehealth option. If there is a way a neurologist, a neurophysical therapist can connect with you virtually, will be equally effective.
What would we classify as safe pain?
Safe pain. Safe pain, can you elaborate more what you meaning from safe pain?
It's not my question, but I'm wondering if people are asking is some types of pain may indicate other things, or if there is something that potentially would be more of a red flag.
I see. So yeah, that's a very important question. So think of this, if you experience pain, which you feel it's more usual in presentation, it's like if you see like your low back pain, day to day it changes, it differs. And if you feel it's more within the usual presentation, then it's more as a safe pain. It's there, but with any movement, any activity you do, it may go away. That may be safe pain, but something where you feel it's very unusual. It's not changing irrespective what you do, how you move, how you turn around and try different things. And that may be something more as not safe, maybe more of a danger pain. And that's when you may need to consult with a primary care doc or with an expert to see what's something causing it. Is there something you need to do right away?
Does the progression of Parkinson's change the type of pain that people may experience?
Yes, at times. And again, every individual has a different experience. The disease progression may have changes in your overall joint mobility. So that might result in increased pain presentation, mainly because of the joint changes, stiffness, slowness, decreased activity.
This is from the care partner side. As a care partner, how do I safely push my loved one to keep moving?
Good question. So this is looking into understanding what's your comfort zone. So asking the individual like what's your comfort zone on a scale of 10, and if they are like okay 4 to 6, 4 to 8 is the comfort zone. So finding ways on how can they do some activities within the comfort zone, their comfort zone. So this way they'll be able to put in more, they'll be able to do more than their routine, or will be more consistent with what they are doing, and that will help them gradually do more and increase their level. So that's one of the very effective ways. And second, if there is a way to connect with the team members, they may also help you focus on retraining the sensory motor pathways, finding ways on how can they better manage, better engage in day-to-day activities. That may be the other way. And then lastly, looking into overall rating of your day-to-day activities. If you see more like, with these activities, your pain is in this level, then finding ways on how do you suppose like walking. If you're able to do walking this long and you're still in the comfort zone, then like this is your baseline. And then if you want to do a little bit more, so you can look into like, how about you add a little bit more walking? So you're still in the comfort zone, but putting in some extra effort to go further out. Um, I say like the objective measure is the best way to encourage your loved ones to make them more involved and get going.
I have another question. Can you comment on the challenge of apathy as a barrier to the self-management?
Yeah. I agreed. Apathy really impacts the overall self-management process training. So as you see yourself being, not being able to engage or take charge, that's when I'll encourage you to look into the group activities. What some group activities you'll like to go, which is more active in nature. So along with just like discussing, learning, what else can you do, and seeing if that helps you better solve, better learn will be helpful. So and then having ways to also create a routine like which helps you better cope with apathy, meaning if you are someone who likes to do certain activities, finding ways how can you get started with that, so that will give you more tools to better self-manage and get ready for the self-management process. So group social activities and some virtual resources will be a way to get going in order to manage it.
I have another question. Someone who has never had chronic pain before has been diagnosed recently with Parkinson's and now is having heel pain and was thought himself or herself to diagnose as at a plantar fasciitis, but now has having deep pain in the knee joint and has had no previous injury before. Could this be related to Parkinson's?
It's hard to say, right? Like for me to say anything, but I'll say if you see your pain changing during the day, especially during the on phase of the medication or the off phase, that's something will help you understand if it's more Parkinson's related. And also if you see a pain changing from day to day, or if it is find ways on how it's getting relieved, and if it is changing, especially with the Parkinson's medication. If it is changing with Parkinson's medication when you're taking the medication, then it may guide us more towards Parkinson's related pain.
Are there any natural supplements that a person with Parkinson's can take that can help with pain?
I'm not an expert on that, so don't have anything to add. But if you have access to the naturopathic doctor who is specialized in Parkinson's or have more expertise, may be able to help you on this.
Is there a safe pain medication that people can take?
Again, it depends on the individual's medical history and presentation.
With the progression of Parkinson's, is there certain things that people should be looking for when it comes to tolerating pain?
With the progression of like pain tolerance is very unique. Again, it depends on so many factors going around, but again, referring back to understanding what's your baseline, what's something you can do on a regular day-to-day routine activities, understanding that will help you to better manage it and still continue doing things around you. So baseline assessment, and again, referring back to the comfort zone, what's your comfort zone for that day, for that time, will be other way to guide yourself.
Is acupuncture effective for relief of Parkinson pain?
It depends. So at times, pain increases your overall sensitivity to just the pain, like the needles and the overall touch. So few individuals are okay. Few individuals are very hypersensitive with any changes or any stimulus going around the skin and may not like it. But if you have that resources in your area and if you think you like to try it, I'll suggest have that conversation firstly with your acupuncture expert and see if they have an understanding of Parkinson's and what something they can do, and see if that works for you after 1 or 2 sessions. So it may need a little bit more exploration.
I have another question. After working out, my muscles are a little sore. Is this normal? Should I work out less, or is this a good pain?
So if you see your like after activity, physical activity, the muscle soreness is there. But if you see it fading away with time as you rest, as you stretch, that may be something okay, because you may have some after effect. But if you see your pain not getting managed and it just bothering you and it just limiting your any activities after exercise, then that needs to be some adjustment. So the best way to do is definitely after you do your workout, find ways on what something you can do to relieve the muscle pain. And then once you discover certain cool down exercise, certain stretches you can do, and that's helping you with pain, muscle soreness, then that will be the best way to do it. And even after that, if you see there is no change, then there needs to be some more changes around the pain overall exercise. So I'll say again, going back to tracking and figuring out what something is helping and what something is not helping will guide you.
Can a mindfulness activity help?
Yes, definitely. Mindfulness activity is really important. It's important to help you regulate your nervous system. So helping you manage your overall sympathetic and parasympathetic response. And it definitely has an impact on how do you process pain. So really encourage everyone to find ways. Doesn't have to be formal meditation. It can be informal walking medication, simple activities, gardening activities, outdoor activities. If getting into it and seeing how it helps you.
Is there any research evidence that hypnosis is effective for pain management?
Hypnosis is affected in general for pain management, but not much research has been done in Parkinson's related pain management. So again, if you have access to it, see how it helps you, and if that's something you feel you want to pursue further, that will give you more strength in discovering what are the new active ways on coping with pain. So that may help you prepare for better self pain management.